Hi, I'm Dr. Carey Hemmelgarn. We've now reached Module 8. This is going to include outdoor hazards. Thank you so much for joining us. So one of the outdoor hazards that we can see in pets is ethylene glycol or antifreeze toxicity. This is seasonally common around the country depending on when people most commonly use antifreeze, but sometimes it's always prevalent in garages and it may be something pets get into. Ethylene glycol is an odorless and sweet substance which leads to ingestion by pets. It's a small molecule that's absorbed across the GI tract very rapidly after ingestion, and it's metabolized by the liver using the alcohol dehydrogenase pathway to the following metabolites. So the metabolites that ethylene glycol gets broken down into is glycoaldehyde, glycolic acid, glycolytic acid, oxalic acid, and formic acid. These metabolites are then excreted in the urine. The metabolites break down products which are then cause the clinical signs we see of toxicity in pets. Cats and people are more sensitive to ethylene glycol than dogs, but it's toxic and lethal in all that are exposed depending on the dose. In cats, the toxic dose is reported to be as low as 1.5 mils per kg, and in dogs, it's been reported that it's approximately around 6 mils per kg. So definitely dogs could get into a higher dose before showing clinical signs than cats. The toxic metabolites cause severe metabolic acidosis, which is responsible for a lot of the clinical signs seen in the initial stages. Calcium oxalate acid forms complexes which deposit in the renal tubules, which result in the calcium oxalate monohydrate to deposit in the tubules and cause edema in the kidneys. Clinical signs of ethylene glycol toxicity are broken down into phases, and we're going to talk about time frame for each of those phases and clinical signs that we would see with those phases. So phase 1 is within the first 12 hours post-ingestion. This phase is predominantly gastrointestinal and central nervous system signs. So we can see vomiting, diarrhea, ataxia, depression, and muscle fasciculations. Phase 2 of ethylene glycol toxicity we can see in 12 to 24 hours post-ingestion. And this phase is categorized by the cardiopulmonary clinical signs that are seen. And these clinical signs are secondary to the severe metabolic acidosis caused by those toxic metabolites that we talked about. Clinical signs in phase 2 is going to be tachycardia, tachypnea, and dyspnea. And phase 3 of ethylene glycol toxicity is 24 hours post-ingestion, and this phase is characterized by renal failure. Diagnosis of ethylene glycol toxicity is made by possible exposure. Ethylene glycol will fluoresce with a black light. So if there is possible exposure, you can shine the black light over their feet and their paws, and you can look to see if it fluoresces. This is a good thing for cats that could potentially have walked through it and then licked and cleaned their paws and had ingestion. But this also gives you an indication of whether there's still evidence on the pet and whether you need to focus on decontamination also. Laboratory changes that can help in the diagnosis and possible exposure of ethylene glycol is that there are benchtop in-clinic tests that can detect ethylene glycol, but those levels have to be greater than 50 milligrams per deciliter in pets, and that's often above the toxic dose that we can see in cats. So cats may show up negative on these desktop tests, but still have ingested enough to show severe clinical signs. So if you have a cat that has possible exposure that doesn't test positive, but has other reasons to believe it could have gotten into, we still should treat them as they are potentially been exposed to that. Other key changes on blood work that can be shown with ethylene glycol toxicity can be a metabolic acidosis. This is usually very profound. It's not usually tiny and you're questioning whether it is or not. They usually do have a very severe metabolic acidosis, and this can be seen within an hour of ingestion. You can see an elevated serum osmolality, and this can be seen very early also after ingestion. You can see isocinuria, or a urine-specific gravity of 1008 to 1012, which this can be seen within 3 hours of ingestion, and cats, as we all know, may not follow these rules, so this may not be something that's consistently seen in cats. Calcium oxalate crystalluria can be seen as early as 3 hours post-ingestion in cats and 6 hours post-ingestion in dogs, so it's important to know what our time frames are for things that we would see. Azotemia, this is noted later in ingestion. It can be seen as early as 12 hours in cats and 24 to 48 hours after ingestion in dogs. We can also see some evidence of pre-renal azotemia secondary to dehydration from the vomiting and the diarrhea in cases that can exacerbate and worsen their azotemia. We can see hyperphosphatemia, hyperkalemia, depending on how we are in renal function at that point. And we can see hypocalcemia, and this is secondary to calcium oxalate crystal formation in the kidneys. For treatment of ethylene glycol, the earlier the presentation and diagnosis, the better prognosis and the better chance we have to try to get these pets through this. Emesis and activated charcoal have limited value due to the fact that it's rapidly absorbed in their system. If there's a known and a confirmed ingestion, the best recommendation is immediate referral to a hospital that has hemodialysis, even if renal failure is not noted. If hemodialysis is not an option based off of location, financial implications, then treatment is aimed at reducing the breakdown of ethylene glycol to those toxic metabolites. So if you can slow that metabolism down and slow the accumulation of those metabolites, we can try to minimize the clinical signs. So Fomepizole or Antizole can be used in treatment of ethylene glycol toxicity because it's a competitive alcohol dehydrogenase inhibitor. The other option is treating them with ethanol, and ethanol has a higher affinity for alcohol dehydrogenase than ethylene glycol, but those are two main options that you can use. They will preferentially bind and metabolize ethanol compared to ethylene glycol. So in that case, the body will bind that ethanol and try to break down the ethanol, but not bind the ethylene glycol. And therefore, the ethylene glycol can be metabolized through the body without breaking it down to those metabolic side effects. Treatment also involves IV fluids, gastroprotectants, antiemetics, and serial monitoring of blood work. We want to see if the electrolytes are worsening. We want to see an improvement to that severe metabolic acidosis. And if renal failure is already present, the treatment prognosis is very poor, and unfortunately, a lot of times they will pass away from this. So herbicides are another household outdoor toxin that our pets can get into. So herbicides help to combat plants that are unwanted outside and tend to have a very low toxicity in pets. Herbicides that have been applied to plants outside are not toxic to pets. The most common reason herbicide toxicity is noted in small animals is if they're exposed to large quantities of poorly stored containers. So that's a big container of an herbicide that's in the garage that pets get into and either drink or it spills, and then they get it on their feet and paws and lick it and ingest it. So clinical signs usually are very acute GI signs such as vomiting, diarrhea, lethargy, hypersalivation. And chronic exposure and toxicity is something we see more commonly in large animals, and that's because they're chronically being exposed to those herbicides in the area that they're living. Treatment is supportive for clinical signs, ideally if known ingestion and know how much of that product was ingested. It's something that you could contact poison control to further discuss if further treatments or considerations should be used. But commonly, people will come in and say their pets were outside on their yard where recently they had landscapers put down herbicides. Those tend to be relatively benign for our pets, and it's really if they get into a large volume. So another outdoor hazard that pets can get into is compost. Compost is an outdoor household toxin. Unfortunately, compost can have multiple levels of toxicity. So compost can contain toxic human food, such as grapes or raisins, which we talked about earlier, which can cause renal failure, garlic, onions, which can cause hemolytic anemia, chocolate, coffee, and many others that are all in those compost piles. It can also contain toxic plants, which we talked about earlier. Also, when food is composting, mold can form, and therefore it can develop tremorgenic mycotoxins in that compost. So history of compost ingestion is very helpful in the diagnosis of this in our pets. Treatment is symptomatic based off of clinical signs, and that if tremors are noted, methocarbamol is the first-line treatment, otherwise supportive care based off of their signs they're showing. So interesting, a new toxicity that has come around frequently is cocoa bean mulch. So that's basically mulch that goes in outdoor beds that's made from the discarded hulls or shells of cocoa beans. It's very popular outside, and it's a newer landscaping item, so therefore pets now are getting into it. So when outside and in the sun, it can smell like chocolate, and that's what's appealing for dogs to eat that mulch. When they're processing the mulch, most of the methylxanthines is removed by theobromide but the theobromide and caffeine are still present. So clinical signs are the same as what you would expect with chocolate toxicity, which is going to be vomiting, diarrhea, hyperexcitability, tachycardia, tremors, and in large doses, seizures. So decontamination is recommended if ingestion was recent, and then to follow up with activated charcoal as long as that can be safely administered. The treatment would be IV fluids, antiemetics, beta blockers if the tachycardia is profound and not responding to fluid therapy. Sometimes sedation with acepromazine may be needed based on the hyperexcitability. And frequent walks are recommended because the toxic compounds can be reabsorbed in the bladder. So if you walk them frequently and let them urinate frequently, they're less likely to reabsorb those toxic compounds. The prognosis is good with treatment, and so we just want to be proactive and know that that's something that could happen. And if they come in with a possibility and show signs of chocolate toxicity, maybe they got into cocoa bean mulch. Another outdoor hazard is mushroom toxicity. So mushroom toxicity in small animals is most commonly a dog-only toxicity. It's rare that cats would be outside foraging the backyard and randomly eating mushrooms, whereas a dog, this is something that dogs do commonly. So mushrooms can be hard to identify, and often pet owners don't have an idea of what mushrooms could be in their yard or which particular mushroom their pet ingested. So we're going to talk about the different types of mushroom toxicity and the main categories that they fall into. So hepatotoxic mushrooms, these are the most common mushrooms that fall into what dogs get into. And in this category are the Amanita mushrooms, with common names being death cap or death angel. The neurotoxic mushrooms or hallucinogenic mushrooms. These tend to be recreational drugs that are found in a house that pets get into, but they aren't necessarily something that are growing in people's backyards. Gastrointestinal mushrooms, this is the largest group of mushrooms and commonly will only cause very mild GI signs if they are ingested. Sometimes muscarinic mushrooms fall into this category, which can cause significant vomiting and diarrhea as opposed to the mild signs we see with other types of GI. But they also can show SLUD signs, the same as what we talked about with organophosphates. So again, SLUD acronym is standing for salivation, lacrimation, or increased tear production, excessive urination, excessive diarrhea, dyspnea, and emesis. So those are things that muscarinic mushrooms can cause. Nephrotoxic mushrooms. So that's going to be our Coryntyrus species of mushrooms that fall into this category. There's been human cases of nephrotoxicity with this type of mushroom, but there's been no documented dog or cat cases that have fallen into renal failure secondary to this. The Amanita mushrooms' toxic principles are cyclopeptides, the three of them being amotoxins, phallotoxins, and virotoxin. These toxins are rapidly absorbed from the GI tract and then can go through enterohepatic recirculation again after they've been metabolized. Clinical signs for this type of mushroom toxicity could be delayed for hours after ingestion before we start to see them. But there are three phases to cyclopeptide toxicity. So gastroenteritis is the first phase, which is going to be vomiting, bloody diarrhea, dehydration, salivation, and abdominal pain. And this phase tends to last about 24 hours. Elevated ALT or elevated liver enzymes are seen in the second phase of this toxicity, which is commonly seen about 12 to 24 hours after ingestion. And the hepatorenal phase, this can be seen somewhere between 3 to 4 days after ingestion. And during this time, elevated liver and kidney values are noted. In addition, we can also see things on blood work that could show signs of liver failure, such as hypoglycemia, hypoalbuminemia, coagulopathies, and neurologic dysfunction secondary to hepatic encephalopathy. Unfortunately, most patients will pass away within 3 to 7 days after ingestion, even with aggressive treatment, if they start to show signs of liver failure. So treatment is focusing on early decontamination with emesis and activated charcoal administration. Treatment is supportive based off of clinical signs. Penicillin G has been proposed to use as it can displace amotoxins from protein binding sites and allows for earlier excretion, and N-acetylcysteine is recommended as a hepatotoxic. So the most common neurotoxic mushrooms are from the Amanita species. They contain hydrazine compounds such as the toxic principle that we know most about, which is gryometrin. Gryometrin is hydrolyzed in the GI tract to monomethhydrazine, which initially causes GI signs, but then can progress to show our CNS signs, which is how we know them as the neurotoxic mushroom. Clinical signs with this type of toxicity include anxiety, restlessness, seizures, and treatment involves early decontamination and supportive care. Pyridoxine infusions has been recommended as the antidote for this type of toxin, but is not well known in veterinary medicine. Muscarinic mushrooms contain muscarine, which causes a post-ganglionic parasympathetic effects that are found in members of the inosebine and the psilocybin genre of mushrooms. Clinical signs are most commonly seen within hours of ingestion, and again, they're mainly characterized by SLUD signs. So again, that's salivation, lacrimation, urination, defecation, dyspnea, and emesis. Treatment for muscarinic mushroom toxicity involves early decontamination and supportive care with symptomatic based off of the clinical signs that we're showing. Giving doses of atropine can reverse the muscarinic signs shown, with ideally a quarter of the dose given IM and the following doses given sub-Q. Hallucinogenic mushrooms have LSD properties secondary to two main toxins, and that's going to be the psilocybin and the psilocybin. The common clinical signs when we see them get into hallucinogenic mushrooms are going to be hyperexcitability, aggression. Sometimes they can be somnolent, disorientation, weakness, hyperesthesia, seizures, hyperthermia are all clinical signs we can see with that. Again, a lot of times we would know that there's exposure based off the possibility of this being in a household. Treatment involves decontamination if early on in the process and not showing neurologic signs, and symptomatic supportive care based off of what clinical signs they're showing. And in some cases, sedatives may need to be used to prevent the patients from harming themselves.